Hi, Dr. Harvey. Today we'll be doing Microbotox using an off-label use of Botox for treating creping, oily skin, and just general skin texture using intradermal and not intramuscular injections. So the setup with Microbotox is a little different than traditional Botox. We much more want them to use a dilute version, and what we'll be doing today and what we've done is we use a traditional 100 units, but we mix it with 2.5 cc's of preservative containing saline, and then take half of cc of that dilution and mix it with 0.5 cc's of lidocaine with epi. What that does is it keeps the solution intradermal. So it basically comes out to a final concentration of 20 units per ml of solution. And basically what we do is then put these into our typical BD insulin syringes and give these microaliquots. Our patient is pre-marked, and a couple of attention points here. You want to be about 3 finger breadths above the mandibular line when you do this technique, and 1 finger breadth lateral to the oral commissure. What that allows us to do is to treat the sebaceous skin and avoid the muscularity of the mouth to prevent any kind of drooping. We then extend it to the tragus and inferior to the clavicle. Well, we'll then cross the midline to the opposite side, and again, being right at the mandibular line, avoiding this no-fly area. You'll see these little marks, and this is where we're going to place our microaliquots. Typically, you're going to use about 50 injections per side, and what this should do, and we'll take some post-op pictures too after she resolves, is to give a little bit more creping, a little bit more lift, and help with texture and some of these minor fine lines. She's already had numbing medicine on ahead of time, and we'll use a little bit of selective ice application as a way to provide analgesia. So I'll show you the first few injections, and then we'll see our patient in follow-up in 3 weeks with more video to come.
So as we start the process of injection, you can see I'm creating these little wheels superficially, spaced out about 1 centimeter apart. Usually we inject about 0.05 ml or so, and each of these dots are spaced about 1 centimeter to 1.5 centimeters. We note, because the lidocaine with epi in the mix, after every bleb, you'll start to see the skin blanch and take on a lighter color relevant to the surrounding skin. Here we note in the preoperative blanched Microbotox blebs that they're evenly spaced and that there's no preoperative bruising. In the 3-week post-op photographs, we observe neckline effacement and skin tightening. Upon closer inspection, pores appear to be diminished, contributing to a favorable cosmetic result. Thank you for watching this video on Microbotox. I hope you found it helpful and informative. For more educational content like this, please visit my YouTube channel at Dr. David T. Harvey Videos. Thank you.